Welcome to Real Vermont News. I'm Bob Frenier here to say somebody's finally looking into things. Today, we're looking into the political left's illogical notion that healthcare costs can be reduced if you take less financial responsibility for your own health. Really? Here's correspondent Chris Bradley with more.
Thanks, Bob. The first example of this dysfunctional type of thinking is that Vermont's politicians are making doctors and hospitals financially responsible for your health. In a nutshell, hospitals and doctors are operating as accountable care organizations, or ACOs, now receive a set per-person fee for maintaining and improving your individual health, instead of a fee for every service they provide. If they can keep you healthy for less than that fee, they get to keep some of the savings. Of course, if you get sicker because you ignored your doctor's advice to take certain medicines, lose weight, exercise more, or quit smoking, your doctor and your hospital lose their bonus.
The liberal politicians who dreamed up this system obviously believe our doctors have great persuasive powers.
Yes, and these same politicians are the ones responsible for the so-called community rating system in which health insurance companies are not allowed to charge higher insurance premiums to people whose lifestyles put them more at risk to get sick. Smokers, heavy drinkers, and people with severe weight issues are not financially liable for their unhealthy habits. Naturally, the cost of health care has shot up for the rest of us, especially young and healthy Vermonters.
And isn't it true that the amount of money a hospital can spend every year is now being determined by bureaucrats? Hospital X gets so many millions of dollars each year and no more, no matter what health care needs their patients have? Isn't that really healthcare rationing?
Yes, that's rationing. Rationed healthcare is the inevitable result of accountable care organizations and community ratings policies. People will be forced to wait for treatment in Vermont, just like they do in Canada.
Obviously, very few elected representatives realize how economically foolish Vermont's healthcare insurance rules are. So, like this video and click your Facebook share icon so all your friends can see it. Then, tell every candidate you meet that they need to rethink Vermont's entire healthcare system. It's not working. And that's all the Real Vermont News we have time for. A lot more happened, and we'll be looking into all of it.